Mansfield today on a Wednesday. Dr. Vicky Skitter sometimes comes in all excited. Oh, you know what we've got to talk about today? And you go, no, because I haven't got a clue. And she says, bariatric surgery. Come, let's talk about bariatric surgery. And I go, what's? She says, well, there are 3 different types, and it's a fascinating topic. So I said to her, okay, well then talk about the fascinating topic in the studio. Don't tell me the whole fascinating topic and then come tell me again. Okay, so firstly,
yes,
what is bariatric surgery?
Okay, so that is gastric bypass surgery and other weight loss surgeries that they do on the stomach and the bowel. Basically, when you make changes in your digestive system for you to lose weight. So it's when diet and exercise and lifestyle changes doesn't help, or you've got serious health issues, those very big patients due to your weight. Some of these surgeries will limit the amount of food that you can eat at a time, and some will reduce the ability to absorb the food or nutrients. Some will do both to help you. It's important to realize that these procedures is a surgical procedure, so there are obviously risks and side effects that could possibly happen. So people, if you're overweight and you're too lazy to diet, don't just go and have surgery. But you have to make lifestyle changes to make sure it is successful. But it gives those patients that's tried everything and that's really obese with comorbidities and unhealthy, it gives them an option, I think.
Okay.
Yeah.
Why consider such drastic measures? Because they are drastic.
Yeah, they are drastic. So it's important to realize that we do have a global obesity epidemic. 20 to 40% of the adults, 1 out of 5 males and 1 out of 3 to 4 females are actually obese. So there's actually a disease itself, so it's very prevalent. There's now sort of a shift away from just losing weight and more towards you want to resolve those comorbidities. So resolve or reverse your diabetes, your high blood pressure, your fatty liver disease. They could definitely do that. They say surgery is definitely more successful than a conventional medical treatment when it comes to treatment of diabetes or resolving diabetes. So percentage-wise, I say in a conventional diet, you can resolve diabetes in about 2%. That's so low. Where versus surgery, you've got a better chance, 25 to 50%. So I know it's very drastic. Obviously not every person that's overweight must have surgery. That's definitely not what I'm saying.
Yeah.
But if you've done your exercise, you've eat less, you've tried. We don't all lose weight the same. It's important. For some people, it's very hard. Some have got very serious metabolic issues. So as I said, I'm not advocating that all overweight people must go and have surgery. But these days, there's even systems in place that will make the medical aid reimburse you. So it just gives you that option, I think.
Where do patients start? I mean, when do you get to that stage where you go, I've got to go and have surgery? How does it work?
Look, there's certain criteria that you have to meet. So if your BMI is over 35, body mass index, and you've got a comorbidity, so you are hypertensive or you've got diabetes, one of those, that would be a criteria. You can't just be 10 kgs overweight and then want to go. Or when your BMI is over 40, when you've got morbid obesity, and it's important for patients, where do they start? That you have to do your homework, because these centers and the doctors, you call them bariatric centers, they're all over the show now. The past 10 years, you can see them, quite a few new ones. They must all be accredited. So the hospital must be accredited, the surgeon must be accredited. There's like a whole multidisciplinary team. So it usually consists of a physician or endocrinologist, okay, the specialist, then obviously the surgeon, there's a dietitian, there's a psychiatrist, because there's, mental health issues here involved as well. Often the anaesthetist, he should be also accredited. There's obviously these patients are complicated patients, they've got special needs if you want to put them to sleep and put them through surgery. And then you must make sure you've got motivated patients. So the patient must know that you must be motivated. You must be able and willing and able to change your lifestyle. You can't just have surgery and think you're going to now just
and then
continue.
just carry on what you were.
No.
Yeah.
So they need to know what to do and what to expect. So this whole process takes about 3 months, eh? So it's a long time, 3 months. And then during this time, they must prove. They often put them on a diet before anyway, and they must prove that they can follow this and make some lifestyle changes. So it's not just go and see the doctor and chop the tummy in half, the stomach in half. Yeah.
What are the different types of surgery, and how do you decide which one you're going to take?
So there's quite a few, but 3 main ones. The most common one is the gastric sleeve. I think we've got a picture up on the screen that shows the stomach, and then basically staples, and then now the stomach isn't the stomach anymore, it's just the stomach, and the part of that stomach they actually take out. So it's not reversible. So now firstly you must realize this is what they do. It's not reversible, but it's a sort of smaller surgery with less complications. It takes like 40 minutes. You have 1 night stay in hospital. There's complications are fairly low, and there's less supplements needed afterwards because you're not interfering with your absorption. You're not shortening the small bowel. So that's the one. As I said, that's the most common one. And then you get the gastric bypass, where they make a small pouch out of your stomach. This is a reversible procedure, so they don't take that part, don't take a part of the stomach out. They just sort of make a small pouch, and then they bypass about 120 centimeters of your duodenum, your first part of your small bowel, and that causes obviously malabsorption. Okay, so you can eat, but not all the food gets absorbed. That's how you eat less, The complications there, okay, number one, you need to know, okay, this surgery is reversible. The complications there could be dumping syndrome. So dumping syndrome is quite common. It's when you put undigested food in, because now the tummy is so small, so it doesn't digest the food properly before it ends up in your small bowel. You get this whole lot of food dumped in the small bowel, and then suddenly your sugar goes up very quickly, not gently, and then the insulin gets pumped out, and then the sugar drops. So you get like sugar highs and sugar lows if you don't eat properly.
Okay.
That's the dumping syndrome. You get internal hernias, you can get reflux, you get heartburn, chronic nausea syndrome. But these can all obviously be manipulated by how you eat and what you eat. So you must just know that, this is, you have to focus. Then also, obviously, because you're doing a surgery that affects the absorption, you will have more supplements that you need to, stuff that you have to supplement with, okay? And that's a lifelong thing. Then the other one is a bit more complicated, the duodenal switch. They make the stomach smaller, like that gastric sleeve, so it's not reversible. They take a part of your stomach out. So it's sleeve gastrectomy they do. And then they also bypass a big part of your small bowel, so that also causes malabsorption. Those they use in the more brittle diabetics, so those really hard to control diabetics. It helps them a lot. Or those with fatty liver disease, morbid obese patients, so real difficult patients. Complications there can be maybe staple leaks, stomach spasm, where they find it difficult to eat or drink. But once again, one can work around that. So you figure out, what is my BMI? Do I want the reversible procedure? Am I motivated? What complications can I handle? What supplements can I handle? And obviously each patient will be examined and dealt with on a
personal basis.
Yeah.
What happens after surgery, doctor?
So after surgery, you'll have a weekly follow-up for the first month. Then at 3 months, then at 6 months, and if everything is going well, then every 2 years. Now this is where the problem comes in, because patients are naughty. If everything goes well and they've lost like almost 40% of their weight and they're feeling great and they're looking good, they don't continue with their supplements. And that's a big problem. So obviously they have to stick to their healthy lifestyle, because you can actually eat past your bypass. You can. And you mustn't, because then imagine you lose 40% of your weight and then you pick up 20% again. What's the point? There's really no point. So the patients must be motivated. Then lifelong supplementation for these patients that had a absorption procedure, basically a malabsorption procedure. So multivitamins, they have to take calcium, vitamin B12, vitamin D. They have follow-up blood tests done quite often to see if there's any trace elements or fat-soluble vitamins needed, any things needed. So they need to get checked all the time. And then, as I said, once the patients, they call it like a post-operative euphoria. When they feel so good, they sort of stop using their supplements. And what can then happen is you get your micronutrient deficiencies. So severe vitamin B12 deficiencies, calcium deficiencies, abnormal liver functions. You can get neurological symptoms. So it's really not worth it. You must, if you're out there and you've had your gastric bypass surgery and you've now stopped taking your supplements, please go for a follow-up and have it checked again. And then the long-term success is really awesome. But it always, everything comes with a bit of a price.
Yeah.
But I've had lots of patients. I mean, in fact, I've got one whole family. Can you believe it? The mom and the dad and the 2 children, they had huge problems. And they look amazing and they feel amazing.
But they have stuck to the regime.
Absolutely.
Yeah. And that's probably the most important part of the entire
I would say
process.
so, yeah, for sure. Yeah.
Dr. Vicky Schutte with us every Wednesday, right here on Mansfield Today. Thank you for being with us. And remember to hit the subscribe button if you enjoyed the show. Bye-bye.